Hi, everyone, and welcome. I'm Jessica, the Chief Buzz Officer here at Zanda. I'm really excited to be here with Damien Adler. Damien is a registered psychologist, business owner, and co founder of Zanda. It's a practice management platform used by health professionals around the world, and now actually an author. This webinar is a chance to celebrate the launch of Damien's new book, The 9 Secrets of Successful Health Practices. Learn how to create a thriving business without an MBA. That sounds pretty cool. It covers a lot of pain points. We'll talk about, the things like burnout, systems that don't work, and how to build a practice that actually supports you. But don't worry, today's not a lecture. It's a relaxed conversation about what's working, what we've learned from others, and how this book might even give you some ideas that you can use right away. So let's go ahead and dive in. So Damien, I have a couple questions for you, but first I'd like to dive into more on why this book and why now. So Damien, you've supported thousands of practitioners and run your own practice. What pushed you to finally write this?
I think we saw a lot of recurring themes. And like you said, my wife and I started a private practice and we grew that and scaled it and sold it along the same sort of timeline. We also, along with my co-founder, Paul, we started Zanda and grew that. And so I've been in the space for a long time. And we saw recurring themes. So both within our practice and talking to lots of colleagues that own their own practices. And then as we started Zanda and we're working with lots of different practice owners, we'd see these recurring themes over and over again. And we thought, let's try and sort of condense what we've learned over that sort of journey, if you like, that, is 15 plus years now, really, condense that into something that's kind of actionable and really kind of breaks down what really matters when it comes to practices and running successful practices, and hopefully give people some ideas and some tips and tricks that means they can learn the easy way and sometimes not the hard way, the way that we sometimes do.
Nice. Now, my second question to you is, what did you wish someone had told you when you just started out?
I think, like many things, that no one really knows what they're doing. Right? So, I don't know. There's always, like, we talk about the imposter syndrome and things. You often see that being talked about now, which I think is a good thing. But it is a real thing, and I think that no one really knows what they're doing. A lot of people are like fake that they do, but internally, really, it's trial and error, and we're guessing. And it's okay, to feel kind of out of your depth when you're starting out, or to feel like other people have it more worked out than you or are better than you at things. That's all normal, right? And one of the things I know that from my own experience, but just with talking to lots and lots of people over the years, that's the norm. That's not an exception, right? So completely okay. And I think if we understand that and say, hey, like, no one really truly knows what they're doing. Everyone is just learning. And those that appear to know what they're doing often have just been trialing and erroring for a longer period of time, right? So, really have a go. Don't feel like you're the only one who is experiencing that.
That's funny. That's very true. What advice would you give to your viewers today? And I think it leads to your number one secret in your book.
It does. Number one, in terms of order, all of them are important, I'm going to say. But really is about sort of starting out with an idea of where you want to go right from the beginning. And we got some initial legal advice. We got some accounting advice. We got some business coaching advice and things in the very early days of starting our practice, which really kind of helped us sort of frame what we wanted to do and where we wanted to go with the practice and what we, I guess, what we wanted to kind of it to deliver both to the community and then to us sort of personally, professionally, financially. And so I guess sort of starting out, with the end in mind. And that's really one of those first sort of tips. And we call it like the rocking chair test, which is sort of if you were thinking back on your life, later on, or you were later in your life and you were reflecting, what would you want to be able to say about that time that you had as a practice owner? What ideally would that period of time look like for you? What would you have achieved? So I think that when you've got that, it sort of really shifts the way that you think, and it allows you to make decisions that are always aligned with that. And that means, often people describe like making decisions as one of the hardest sort of things to do. But when you've got a clear like idea of where you want to go, that makes those decisions easier, because it's, well, does that take us further towards that goal and that outcome, or further away from it? And it's amazing when you've got that a bit of a vision about what you want to do, how much simpler everything else is. And that also doesn't mean that you can't change it. It's just start with it and you modify your vision and where you're going, as you get more data and as you find what you like and don't like. So it's not about locking in, but it's to sort of have some guiding, principles and direction.
That's great. The end in mind is a great mindset. I feel like even as a personal goal, it's good to think of like, what is your rocking chair? Like just overall for everybody, not just the practice.
Yeah, absolutely. And it applies, like you think about it in terms of relationships and raising kids and whatever it is that you do, even, sporting achievements and goals, fitness, whatever it might be, if you have an idea of what you want things to look like, a lot of other decisions, you're looking at it through a particular lens, I guess, and that makes decision making, a lot easier.
Yeah, I love that. Now let's go into the next topic and let's dive into more like 1 to 5, the tasks that really drain practitioners, clinicians. Damien, first question for this is, so many practitioners tell us they're drowning in admin. What is the one small system that changes that made a big difference for you and that is for others as well?
Yeah, I think this is like super true, right? And I think most people can relate to this idea that admin tasks they don't just grow proportionally with the size of your practice, they grow exponentially, right? Because, sometimes you think, well, if I have one practitioner, like if I move from 1 to 2, well, that's just sort of double the admin, and go to 3, it's 3 times. But actually, no, because you get an interaction effect, right, between practitioners and just activity, right, that occurs. You're now managing room bookings and you're coordinating after hours cover for more practitioners and so forth. So admin tends to be something that grows exponentially, sort of disproportionate often to the way that you're growing. That's if left unchecked, if we're not sort of aware of it, not focused on it. So moving as quickly as possible, and I guess having the mindset of trying to be really efficient and moving from manually doing things to automating things. And we have this concept of onceifying. So onceify means like do it once, right? But make sure you don't have to keep repeating that same thing. Get some efficiencies from, as you kind of scale. And I think there's lots of different ways you can sort of onceify, and we sort of touched on that a bit in the book. But I think, thinking back on our practice and the things that make the biggest difference, certainly streamlining your kind of new bookings and your onboarding processes for patients makes a huge difference, right? Because you want new patients flowing into your practice all the time. It's kind of the lifeblood, of a practice. And so streamlining that, is great for everyone, great for the practice, great for the patient, because it's very organized. And that really helps get the admin under control, because you get it sort of organized from the start. Then that makes everything else easier.
Nice. And actually, now that you're saying that, I do case studies here at Zanda, and I interview a lot of our users. And one thing that actually really aligns with what you're saying, one of our users, Catherine Turner, she's based out of Australia. She says, don't underestimate the power of small efficiencies. When you're on your own, having one system that does it all, from calendar, communications, notes, and reports, means that you're getting yourself focused so that you can focus on the care, not just the admin. Which is great. It's just onceifying it, putting it on one platform and making you more efficient, which is, I think the goal for all clinicians.
That sort of feedback's really great. Like I've had, it's music to our ears, of course, because that's what we're trying to build, right, with the system. And I remember once doing a live presentation, as in person, somewhere, and it was something, some people came up afterwards from different practices, and they were making a very similar kind of observation, and they were just giving some practical examples of how they used to do it, and then since they had Zanda, what they were doing, and it's, just so much more efficient. And they were explaining it in different ways, like that there's a financial side to that too, less admin overhead, but also from a headspace point of view, having things more automated, and all the rest of it just makes life a lot easier. And you get less encroachment of clinical work or admin work attached to your practice into your personal life, right? And that's really important in terms of people, staying engaged and motivated in the health space. And I think the other thing to think about when we're thinking about oneifying, and again, I think we do cover this idea in the book as well, is around building simple systems. So you don't need to try and approach and oneify your entire practice, right? Like that's overwhelming, particularly if you're haven't been doing that today. But you can just actually start small and do little things, and those little things add up, really quickly. So I think just think about what steals most of your time. What do you not like doing, perhaps, and what's really inefficient, and start by oneifying those things and do it bit by bit. It doesn't need to be a big, overwhelming task.
Yeah, the one thing that she had said that not only does it do all that, but she had mentioned it also grows with you. So she says, as you start small, the tasks are smaller, and as like you said, they start to grow depending on how big you get. You bring in people into your practice, and so the best thing of that she's noticed that with Zanda is that it grew with her from start to finish as she started her private practice.
Yes, it's actually been one of the challenges for us, to be honest, too, about how as we've grown Zanda, because we really do want to cater for both small practices that are relatively simple, that it might be solo practitioners that are running. They still have a lot of admin, but through to multi-location franchise practices, and we have the full spectrum of practitioners. But we actually do actively think about each of the different positions that people are, the type of practice and context they're in, and have sort of designed it. So it's really good when we hear the feedback from both ends of the spectrum, because both are perfectly, it all depends on what people are trying to achieve with their practice. And having a solo practice can be hugely rewarding and keeps things simplified. Other people want to grow and scale, and so we really have focused on making sure that you're just starting out, bang, it's easy, you can pick it up and go. But if you do want to run multiple teams, multiple locations, multiple disciplines within each of those locations, you can do all that.
Yeah, you're able to without having to switch the platform. That's awesome.
Yeah, exactly.
Awesome. So let's move on to the next question. Let's talk about money talks. I know it's like an uncomfortable feeling. Not a lot of people like to talk about money. But Damien, my question to you is, why is financial clarity such a struggle for clinicians, and what helps them change that perspective?
I think, to begin with, if we think about where health practitioners sort of come from, they get, the streams of study that we do and so forth, it's all focused on, and so it should be, but focused on the clinical element, the delivery of services, the patient experience, making sure that as a professional, we are doing a great job, and that we're doing things in a way that's, uses current thinking and is evidence-based and blah, blah, blah. But what that means is, by default, people typically don't get into the private, health space, with the view of being business owners, or it's not the primary driver. So I think that means that sometimes people are just sort of, it's not as a natural a skill to both think about money, think about business as a system that generates money, because we do need to think about it that way. It does need to generate a profit to be sustainable. And then when it comes to the more detailed kind of money talks with patients, that's another level of awkwardness that people sometimes struggle to overcome, and it takes a bit of a mindset shift to really feel confident about that, seeing their practice as, yes, something that does good in the community and provides services, but as a business that generates more profit, more money than it costs to run, right? That's what it comes down to. It boils down in really simple terms. And so, and we see in the education streams that there isn't a lot of that built into the courses. And at various times I've done guest lecturing, to universities and things that have education sequences with healthcare, and it's interesting that the questions that people sometimes have, students are sort of advanced stages, they're not long from going to the into the field, they often have these sort of questions. They're asking about the realities of running a practice and things like that. And you're like, oh, they're hungry for that information. So that's good. Probably there's a hint in there for
in school. You probably are not learning that part in school.
That's right. Yeah, totally. So, in the book, we've really tried to just sort of, I guess, look at some common mistakes that people make, some common traps that people, just a way of sort of thinking about it, and I guess helping people, think about it in a way that leads to them achieving their financial goals as well, because it's important.
It is. It definitely is. My next question to you is, let's talk team culture. Even for like solo providers, what is one tip from the book that can improve that experience for the clinicians and practice owners?
Yeah, I think when it comes to teams, I think like hiring the right people is, that's a really, I'm being a little bit flippant, because how do you hire the right people is the real question, right? I think most people would say, yes, of course we want to hire the right people, but understanding who the right people are for you, again, sort of goes back to that idea about the values, what you're trying to set up as a practice, what you want your practice to stand for, what sort of values align with your own, view of the world. And there is a very large variety of valid views, right, about what you want your practice to be. So I'm certainly not here to preach like what should be your values, but the key thing is when building a team is to make sure that you have an alignment, between that and who you're recruiting.
Yeah.
And I think that the more that you can do that, you get like a positive cycle that can occur, because if you get people that align with your values and how you're approaching the work, then there'll be a sense of teamwork, a sense of shared goals, a sense of sort of alignment. Those people will be happier. You get a happier workplace. You can add more people to that are also similar. They can be different personalities. I don't mean we're looking for a homogenous type of person, but where those key things align. And then you get a positive atmosphere, you retain people, for a lot longer. Where we see issues where there's misalignment, then it becomes quite evident, because you get churn, you get dissatisfaction, and you get a conflict of values. And we see that often the cause of that, it's because there isn't that foundation. And so understanding what your values are and how to look for how to detect that.
Yeah.
And that's why we put that in the book, right? Is because that culture thing is so important. And we have lots of incidental conversations with people in Zanda, because people are adding and removing practitioners and things, and they're talking to us about that. And often we often have very sort of friendly kind of relationships with our customers, and they're telling us, talking to us about things, or sometimes they'll ask us for advice on things, and we can see the themes. They'll be talking about why someone's churning out, from their practice, or why they might have had that, and often we're talking to them about those things. So we see it as a common theme that alignment of values makes a huge difference.
I bet. Now, my next question to you in this is, what helps avoid the burnout when growing from a practice to leading others? How can you share your experience with the viewers today?
I think you sort of look at where your natural energy and enthusiasm is, and what energizes you versus sort of what drains you. And I think if you're sort of aligned and you're focused on something that is energizing and meaningful to you, then it's sort of self-sustaining. It's giving you energy. It's giving you kind of enthusiasm. If people find that their practice is getting kind of out of control, it's going in directions they don't want, there's been a lot of time on annoying, like sort of HR-y type things, issues with practitioners and stuff like that, because of some of those other foundations that we've sort of touched on aren't right, then that tends to sort of lead to burnout. We also, I guess, see where things aren't optimized well, right? And sometimes, this is another one of those kind of you're not alone type of messages here, but where there is often practitioners may struggle with organizational skills, and that's not, I think we all can, but it does come up a fair bit that people struggle to stay on top of everything, right? Or feel that if anything isn't up to date and done, it's highly stressful. And so helping people kind of, or getting those systems in place to kind of reduce all the work that can be automated or delegated, that really tends to kind of help reduce, burnout. We used to sort of talk about, like, in our practice of trying to create the ideal environment. What do we think about when we were setting up a practice? When we were first studying, even, like, what did we dream about? What it would look like, and trying to make your reality as close to that as possible. Is energizing, and it becomes like a positive cycle.
That's true. I mean, my dream is to become a pop movie star, so maybe that might happen. I mean, you never know.
You never know. That's right. You just keep going for it.
Just kidding. So to wrap up really quick today's interview, I want to do a couple a rapid fire reflection, asking you a couple questions.
Okay.
Just for the viewers. I know you were not expecting these, but let's go off of what you can share with us today. The one thing that you use to overthink about in a practice, what was
that? Pricing.
Okay.
Yeah. Pricing. I don't think, just to be transparent, we were operating, we sold our practice. I think we had it for 15 years, something like that. I don't think we ever really, really nailed down our pricing strategy. We did some things really well. Don't get me wrong. I'm not being excessively, harsh on myself, but I think we used to really overthink price rises, right? And that you really, the advice is, and what we learned and what we can see with other practices, that there's a strategy to price rises. There should be a consistency to it. Definitely overthought pricing, in that we're reluctant sometimes to increase prices where everything tells us that we should, and we knew we should. And 99% of the things that we were always worried about with price rises were completely lived in our heads. Right? They do not play out. And the other thing with pricing, and I have mentioned this a bit in the book, but you're just delaying the inevitable anyway, right? Yeah. So it's better to don't overthink it. Do it on a regular schedule, and it will be fine.
And one of our recent case studies also that I did this a couple months ago, her name was Marizel. She's out of South Africa. She said the one thing that she realized when she did pricing is she tried to compare herself to other clinicians in her area. And she said that was the worst mistake I could have done. And I was like, why? And then she dove into, she goes, everybody's different. You offer different things. She goes, never compare yourself to somebody else.
No, absolutely not. And I think too, there's going to be a race to the bottom too, and which we never, we actually never fell for that. But there is a race to the bottom that you see sometimes. And do you want to be providing the bare bottom? Is that the end of the market you want to be kind of competing with, and then cutting corners and doing things? And this used to come up for us because we did a fair bit of corporate work as well, and government work in our practice. So we'd pick up contracts and things. And if we didn't like the tender terms, the parameters that they set, so we thought that they were really overtly inviting the bottom end of the market, and they opened up the eligibility, for instance, for the tender in our case. So we were running a psychology practice, but if they were opening up the tender for providers that had very low level of education or governance, or what didn't need to be registered, etc., we're like, okay, this organization is trying to get the cheapest way to kind of tick a box and say they're providing, in our case, sort of mental health and development sort of support services, and we're like, we're just not going to participate, and so the funny thing is, a side story, we would often overtly not, and the people offering a tender would contact and say, oh, we were expecting a tender from you, how come you're not providing? Because maybe we were providing to that company already. We're like, no, with the terms of it are just right. They're like, oh, okay. Very often we would end up with that business anyway, right? Because they would go with the cheapest provider, right? The cheapest provider would turn out to be a disaster in one way or another, right? Predictably a disaster if you go to the bottom, and then they would come back to us and say, look, can you do this? And now we're talking on our terms because we said, well, this is what we're going to charge. But this is what we're going to provide. And now the whole negotiating thing, instead of us competing against everyone else to get, that they're actually back. So I think with pricing, being clear about a strategy to it, and basing on the right things, not just a sort of, you look at the market, but should not let that be your defining thing.
That's true. Very true. My next question is favorite piece or feedback that you like to give that you've gotten by others in the industry.
Right. I'm going to say it was about the chocolates, but I'm going to leave that. People can read the book and talk about why, because it's why the chocolates feature. But we got feedback about chocolates at our practice. I'll let you read that. I think the other thing, though, which, I think a favorite bit of feedback is about we had a template and a structure for our correspondence with referrers. So in our context, we would have family physicians or general practitioners would refer to our practice. And we had standardized templated formats to how to respond, to provide recognition of that referral and updates, right? So obviously the content was different based on the patient, but we had a structure, and the structure was very tight and short. And one of the favorite bits of feedback that I got was from a referrer, a doctor who pulled me aside and said, hey, I really like how your practice, you do this. It's all the information succinctly in a structured way. We know how to read it. It's efficient. Love it. It's predictable. We're not wading through pages of paragraphs of, commentary. I really like that because that's what we had in mind. Like that was the intent. But to actually get that validated in an unprompted way, that was actually one of the things that the fact I remember it now, at least years later, is a sign that
that's a huge win. Huge win.
It was a win. It may not be the biggest thing in the world, but to me, I was like, that's great. That was efficient. They like it.
Right on. Now, my next question is, what would you say to yourself, your past self, about this book? Things that you think you would say to yourself now?
Well, I'm hoping it's helpful. I think, I think I would hope that I would read it and say I can learn without making a lot of the same errors, right? So hopefully, that it would be like saying, well, that's good. There was a shortcut to, people would probably arrive at the same destination, but end up sort of having to do a lot of trial and error. So I think the past self would say, oh, good, that saved me a lot of time and some money and some heartache. So, and I think if we can achieve that, if people read it, and look, I'm not expecting that every page that they will say, oh, that's a new idea. I mean, I think people will relate from their own experience to some things. But if people can take away some key, things, or it shifts their thinking in some, small or larger ways, then, I'll be happy with that.
That's great. Yeah. Really keying back to their mindset and seeing and aligning with their goals.
Yeah, exactly.
And then the last question is, do you have a secret number 10 in the book? I know we have 9 secrets in the book, but do you have a 10th one that you wish that made the book?
I'm tempted to say the secret is, or the one I held back is that you should always hold back something for the second book, but let's see whether people read that. No. Okay. Outside of that, I would say, success builds on success. Mm-hmm. Right. And so with anything, right, like sometimes it can be overwhelming, like when you look at something to start. And I think if I was going to add another secret to it, I guess it's more general, but, the idea that just start with something and get a small win, right? And then that small win, becomes fuel for the motivation for the next thing to focus on, right? So if you've got lots of things that you need to, or think you need to change in your practice and, or in your life, whatever it might be, is just focus on something that gives you a small win. And then use that to kind of motivate, or it'll become more self-sustaining. So that idea of success builds on success, whether it's ourselves, whether it's with people we're working with, if we're mentoring a team or anything like that, keeping that in mind, I think, is a key. Otherwise, it gets overwhelming, right? Like things can get really overwhelming, and sometimes the more we learn about stuff, the more we realize of what we have to do. It can almost become like anxiety provoking. But I'd say, yeah, that's great. Like learn about it, but then just focus your energy on on one thing, get a win, and then move to whatever the next thing is that makes sense for you.
Nice. Thank you for giving me the feedback on those questions. I know they were a little off that you didn't expect. But
That's good. It keeps it surprising.
Yeah. So some of the tips in the book are surprisingly simple, little things that really get people talking about your practice, as well as how to get your clients to greet them from the beginning of the time that they enter your practice, the vibe, the overall office space, and even something small like something waiting in the waiting room, like the chocolates, but you can learn about that more in the book. But other than that, the secrets we've shared today aren't just rules, they're more reflections. And some might feel like they might click with you, some may not. And that's totally okay, like Damien said. But we want to make this a little bit more of an interesting webinar and go ahead and launch a limited offer to you guys viewing today. So I'm going to bring up the slides so you guys can see really quick. And what we're going to be doing to celebrate the launch of Damien's book is we're going to be running a limited time offer, so that if you haven't grabbed your copy yet, now is the time. We're going to be running a offer for 99 cents. We'd love to hear, what resonates with you in the book. Share your thoughts, make sure that you're hashtagging and sharing your thoughts by using hashtag ZandaBook. And that way you can tag us and let us know what you liked in the book, or you purchased the book, what really stuck with you, what is your rocking chair moment that was your awe moment from reading the book, as well as something that you felt like you can add to your practice that you hadn't thought that maybe came across the book. But today, if you do that, we're going to be also entering all those that purchase today a $50 gift card. We're going to be doing a raffle to pick 2 winners within the next 3 days of our launch today. So keep a lookout. We will keep checking out those hashtags. And Damien, did you want to say anything else to the audience?
No, look, just really hope you enjoy the book and find it helpful, and I really love to hear your feedback, and as you said, Jessica, the things that really resonated, great to hear, and yeah, thanks very much for talking today, Jessica. It was good fun sort of going over everything, and yeah, really exciting to have this out there and in the hands of people, and hopefully making a difference.
Yes. And just a quick note, I didn't mention specifically, but if you grab the version, it's going to be the 99 cents is for the Kindle version. So if you guys grab that, you guys definitely, I know everybody likes different versions. You can get a paperback, a hard book, but the limited offer will be for the Kindle version, FYI.
And thank you.
Of course. Thank you again, everyone, for joining, and we'll see you guys till the next time.
See ya. Bye.
Bye.